For transgender minors in Western Mass, a decision by one of the region's largest health systems means their medical care is now in limbo.
Tonight, what Baystate Health is pausing and where families can turn.
Very much anger. I think I texted my mom first, because my mom is like a very accepting person and like very much accepted me coming out as a kid, and was like, I am very scared and I'm very sad.
Baystate Health notifying families their hospital will no longer provide hormone medications or puberty blockers for patients under the age of 18, while continuing to provide gender-affirming mental health counseling for children and adolescents. The change was outlined in a letter sent to families on February 9th this year.
It's scary, and especially sad because Baystate is like the place that I got all my care and I got my surgery and like got all these things done, and have been like a pillar in the community.
Kevin Green was 17 when they began taking hormone blockers at Baystate nearly 15 years ago. With access to gender-affirming care as a minor, the Northampton resident was connected with an endocrinologist, started hormone blockers, and later began taking testosterone.
It wasn't scary like it is now for kids coming out, especially in like this day and age. But it wasn't scary for me back then. I came out like 15 years ago, and it was just like very accepting.
The hospital's decision comes after federal funding threats by the Trump administration to force policy changes targeting social, educational, and health programs across the country. The Department of Health and Human Services proposing new regulations that would cut Medicare, Medicaid, and CHIP funding to hospitals that provide puberty blockers, hormones, or surgeries for transgender minors. That move is being challenged at the state level. We received a statement from Baystate Health, which says in part, Baystate Health is working with the impacted patients and their families to transfer their care to a trusted healthcare organization in our region or another provider that our patients and their families choose. Nearly 70% of Baystate Health's patients rely on Medicaid and Medicare for coverage, and preserving access to care for all 800,000 plus residents of Western Massachusetts is a responsibility we take seriously. Green says gender-affirming care isn't optional for transgender people. It's essential. And while Baystate will still offer gender-affirming mental health counseling, Green argues no hospital should deny someone the ability to feel safe and at home in their own body.
Feeling safe and comfortable in your body and like autonomy is like a basic human right. Like if I was to just stop my hormones, my bones would get less dense, and like my mood would be all over the place. I'd be very groggy, and like you have to have a hormone, and that rapid switch from one hormone to the other hormone is not great.
For families looking for the next option, advocates say other choices are limited in funding efforts. Trans Health in Florence provides gender-affirming primary care and specialty care for trans and gender-diverse people across the lifespan, both youth and adults. While they receive minimal state funding, Trans Health relies almost entirely on individual donors and grants with no access to federal funding. In a statement to Western Mass News, Trans Health said the following. Trans Health welcomes trans youth from Baystate Health as new patients. We have hired additional providers and are ready to deliver expert, compassionate trans health care to all youth from Baystate. We are working closely with the hospital to help make this transfer of care as smooth as possible for families. The clinic is currently accepting new patients 21 and under for both primary care and specialty care, as well as patients who are 18 and older for telehealth specialty care. While other options exist, Green says this decision takes a toll on the LGBTQ+ community in Western Mass overall, and says holding tight to your community is more important.
Make room for trans people, hold them, offer things. It's not just like calling your representatives, it's like calling your trans friends.
As Baystate pauses medical treatments for transgender minors, families are now navigating new providers, new distances, and new uncertainties, hoping the support around them remains steady even as their care changes. In a December 2025 statement, Massachusetts Attorney General Andrea Joy Campbell announced that she filed suit against the Trump administration. Campbell claims that the U.S. Department of Health and Human Services cannot unlawfully threaten providers with a declaration that attempts to limit access to gender-affirming care for young people.